Hi guys, I'm here again. We often hear a word like heart attack, but never try to discover that what is the major cause of heart attack, how it comes up, which are the symptoms of serious heart attack, how can we survive from it. But first of all, we have to face a challenge that how can we recognize a heart attack? A heart attack happens when your heart cannot get enough oxygen because the blood flow is disturbed. The heart muscle cannot pump properly and tissue rapidly begins to die. About 735,000 Americans have a heart attack every year. However, only about 27% of people know all the urgent symptoms of a heart attack. Crushing chest pain and upper body soreness are the typically heart attack symptoms, but there are other warning signs you should also heed. Recognizing the sign of a heart attack and getting to the hospital immediately can mean the difference between survival, irreversible tissue damage, and death. If you have any doubt about whether the pain you are experiencing is a heart attack, seek medical help immediately. Pay attention to chest pain. A pain in the chest, whether it's sharp or dull, is the most common sign of a heart attack. People who are having heart attacks often say that they feel squeezing, fullness, pressure, tightness, or a sharp sensation in the corner of the left side of the chest. This feeling may last a few minutes or more or disappear and return later. Chest pain that stems from a heart attack is not always crushing, heavy feelings that some people describe, often called the Hollywood heart attack. It can actually be quite mild, so don't ignore any type of chest pain. Keep in mind that chest pain is not always present when a heart attack is occurring. In fact, over half of heart attack patients don't experience chest pain. Don't rule out the possibility of a heart attack just because of you aren't hurting in that area. Check for discomfort in upper body. Sometimes the pain from a heart attack radiates from the chest area outward, causing discomfort in the neck, jaw, abdomen, upper back, and left arm. The pain in these areas is usually a dull itchy. If you haven't recently worked out or done anything that could cause upper body soreness, this type of pain could be a sign you are having a heart attack. Watch for dizziness, lightheadedness, and fainting. These are also extremely common signs of a heart attack, though they are not present in every person who is having one. Like other heart attack symptoms, dizziness, lightheadedness, and fainting are also signs of other illness, so they are easily overlooked. Don't ignore these symptoms, especially if you are also feeling chest pain. Women tend to have these symptoms more frequently than men, though not only women experience them. Monitor your breathing. Shortness of breath is a subtle heart attack symptom that could not be taken lightly. It is distinct from shortness of breath related to other illness because it seems to come out of nowhere. People who have experienced shortness of breath related to a heart attack describe feelings as they have been experiencing heavily, even all they have been doing is sitting and relaxing. Shortness of breath may be your only heart attack symptom. Don't take it lightly, particularly if you have done anything that typically causes shortness of breath. Seek emergency medical help if you experience this symptom. Watch for signs of nausea. The nausea may also lead to breathing out in a cold sweat or even vomiting. If you are experiencing these symptoms, especially in conjunction with other symptoms, you may be having a heart attack. Monitor your anxiety. Many heart attack patients get extremely anxious and feel what is referred to as sense of impending doom. This feeling is not to be taken lightly. Immediately seek medical help if you experience this extreme emotion. And thank you so much for giving me your time. Please share this video as much as possible so that everyone come to know about it and treat it immediately. But don't forget to subscribe this channel. Thank you so much.